Sarah's nursing stuff. Take one.
Hi, my name is Sarah. I'm a student nurse at Central Georgia Technical College, and today I'm going to be demonstrating ways to prevent pressure ulcers and ways to access the skin and treatments for pressure ulcers. The first thing you want to do is refer to the Braden scale. The Braden scale is broken down into 6 different categories, including sensory perception, moisture, activity, mobility, nutrition, and friction and shear. Today I'm going to be taking care of a 68-year-old female patient who is a quadriplegic. She has no sensory sensation and she is completely confined to the bed. And according to the Braden scale, she is at a level 6. Now, using the Braden scale, you need to be aware that the lower the number, the higher the risk is for a pressure ulcer. 6 being the lowest number you can get, and 24 being the highest. Now, like I stated earlier, Miss Reynolds is at a level 6, therefore she is at a very high risk for a pressure ulcer. Now I'm going to proceed to access her skin. And usually you want to maintain as much privacy as you can with the patient and provide them as much modesty as possible. But for the sake of this video, I'm going to uncover her. I'm first going to start with the heels, and you need to be specifically cautious of any redness that you do come across. You also want to pay special attention to bony prominences, including the heels, the elbows, the sacrum, and the head. I'm going to rotate her on her side to assess her backside, including her sacrum. Now, usually you would assess the skin, but for the sake of the video, I'm going to keep her gown on. Also, you want to use what's called the blanching technique. The blanching technique is whenever you come across a reddened area, and you take 2 of your fingers and press down, and once you relieve those fingers and the area returns back to the normal skin color, then it's considered normal. But if that area does in fact remain red, it does symbolize the beginning of a pressure ulcer. Okay. Also, for patients who have limited mobility and are confined to a bed, you want to be very cautious of any kind of shearing or friction. Now, to avoid any kind of shearing, you want to keep the head of the bed at 30 degrees or lower. You also want to keep like a bed sheet or any other kind of device to move your patient. Because you don't want to glide them or slide them up against the bed. You want to pick them up and appropriately move them upwards into the position where you want them to be. Also, for pressure ulcers, you need to maintain good nutrition. And anytime that they do soil, you want to change that diaper as soon as possible. And you also want to maintain routine checks for any kind of soiling or moisture, because moisture does in fact interfere with any kind of wound healing if there is a pressure ulcer, and it does give it a higher risk for a pressure ulcer. Also, whenever a pressure ulcer does occur, they are staged. Stage 1 being still intact but does have redness on the skin. Stage 2 is an ulcer that can be intact or ruptured and is also considered partial thickness to the skin. Stage 3 is a full thickness damage to the sub-Q tissues with visible fat. Stage 4 is a full thickness damage to the skin and tissues showing bone and or muscle. You also have unstageable pressure ulcers, which aren't able to be staged because of the amount of eschar and slough that is in the pressure ulcer, but it is also considered a full thickness tissue loss. You also need to be cautious of any kind of deep tissue injury, which is a purple or maroon area within a localized area. This area can be skin that's intact, or it can be a blister. And for the treatment of pressure ulcers, you need to manage any kind of local or distant infection. You want to remove any kind of necrotic tissues. You also want to keep that area dry and avoid any kind of moisture for wound healing. You also want to, whenever cleaning the wound, you want to clean it with a normal saline solution and also use the appropriate dressings. You can also do a debridement where you remove the necrotic tissues, and your patient also might be on an antibiotic for infection or a topical antibiotic. And now, like I stated before, risks that you do need to be aware of is the mobility. Are they able to move? How often are they able to move? And you want to maintain as much activity as possible. Also be aware of poor nutrition. And whenever a patient does acquire a pressure ulcer, you want to keep them on a high protein and high calorie diet. And like I stated over and over again, moisture. Avoid moisture. Now, your overall goal for pressure ulcer is prevention, especially with an older patient where their skin is thin and the elasticity is decreased. Their circulation is also decreased. They're at a very, 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 very high risk for a pressure ulcer. So just prevention. You always want to prevent pressure ulcers because once they acquire, they are hard to reverse. Thanks, guys.